Well, there are reports now that hundreds of graduate doctors are facing unemployment next year. The South African Medical Association trade union says that the contracts of at least 225 of them will come to an end in January amid crippling staff shortages at government hospitals. Let's speak to SAMA's Dr. Mvuyisi Mzukwa, who's joining us now. Doctor, a very good afternoon, good evening, in fact, to you. Welcome to News at Prime. This situation that's now being reported on, when did you first become aware that these doctors' livelihoods basically were at risk?
Well, good evening to you and to your viewers. Always a pleasure talking to you, Tembeke. The South African Medical Association has always been aware that there is a great chance that doctors come beginning of the year, they will not be employed, those that are coming out of community service, more than 200 of them. Because, as you know, the budget for health has been declining over the years, and on top of that, there is no priority in terms of employing healthcare professionals, regardless of the fact that there's a dire shortage of healthcare professionals, especially doctors. And you know, it was announced in Parliament by the minister that we've got about 0.8 doctor per thousand. And you know also that some of our colleagues have unfortunately died due to COVID-19. Others have moved abroad due to uncertainty around policy and many other factors. So you'd expect that there will be that move towards hiring more doctors, especially if we're talking NHI, not just a political rhetoric.
And is it really as simple as provincial health departments, as is now being reported, not having the money to keep these 200-odd doctors on?
You'll recall that a few years back, I think it was last year or year before, when Limpopo told post-community service doctors that they must go to private. They can't employ them anymore. It happened also in the Eastern Cape, you know, and it's amazing because these are rural provinces. So you'll recall that also the mandate to employ at that level post-community service is no longer a national prerogative. It's the provinces who must make available posts for doctors to be employed so that they can obviously make sure that there is adequate quality service delivery in the hospitals.
Is government talking left but walking right when it comes to facilitating or, in fact, resourcing health facilities in the country, including the employment of adequate doctors and nursing staff?
That's quite correct. You will recall that according to the World Bank, and I think it was in 2018, you know, this was highlighted in the reports, and that South Africa has dire shortages of healthcare professionals. Also, HASA has highlighted this issue of shortages of doctors and nurses, actually, in South Africa. In fact, there's been a fight in the courts of law for government to open up the training colleges for nurses. But with doctors, the problem is post-community service. Where you find that when they're done with community service, they can't go anywhere. They are told to open their practices, or else they migrate to other countries. That is what is killing us, because it means South Africa is training for other countries instead of training for their own communities. We know that there are rural communities that don't have professionals, but if we can't employ them, telling them we don't have enough funds, we can't train specialists. You know, there's few registrars or those that are specializing, trained to be specialists.
What needs to happen for the situation to change?
Well, obviously there is a 2030 strategy, you know, for healthcare, human resource for healthcare. I think we need to strengthen that, and I do think that we need to put more money, you know, to finance the healthcare sector, not only to deal with administrators. I think in the provinces, if you go to provinces, there's lots of administrators. Instead of having, you know, people on the ground, nurses and doctors, you'll find districts having so many clerks there, and I don't know what they are doing, and so many directors, which are useless when it comes to service delivery.
Dr. Mvuyisi Mzukwa from the SA Medical Association, grateful for your time as always. Thank you.